Hi, my name is Paliz. Today I'm going to talk about a fully studied report of Andexanet alpha for bleeding associated with factor XI inhibitors. Definition: Andexanet alpha is modified recombinant inactive from human factor XI developed for reversal of factor XI inhibitors. Factor XI inhibitors have a favorable benefit risk profile for the treatment and prevention of thrombotic events but might cause or worsen acute major bleeding with substantial morbidity or mortality. Acute major bleeding episodes that are associated with the use of factor XI inhibitors may be difficult to treat for a lack of a specific reversal agent.
Andexanet alpha is a recombinant modified human factor Xa decoy protein that binds factor Xa inhibitors. This reduces anti-factor Xa activity and has been shown to reverse bleeding in a preliminary analysis. The Annexa 4 study was a multicenter open-label single-group study of Andexanet in patients with acute major bleeding. 352 patients who presented with acute major bleeding and had received one of 4 factor Xa inhibitors, apixaban, rivaroxaban, edoxaban, or enoxaparin, within 18 hours were given a bolus of Andexanet followed by a 2-hour infusion. The primary outcomes were the percentage change in anti-factor Xa activity after Andexanet and the percentage of patients with excellent or good hemostatic efficacy 12 hours after the infusion. Hemostatic efficacy was defined as excellent, good, or poor on the basis of pre-specified criteria. The safety outcomes included death, thrombotic events, and the development of antibodies to Andexanet, native factor X, or factor Xa. In patients who had received factor Xa inhibitors, there was a marked decrease in median anti-factor Xa activity. 82% of the patients who could be evaluated had excellent or good hemostasis after treatment. Death occurred in 14% of the patients, and 10% had a thrombotic event. No antibodies to Andexanet, native factor X, or factor Xa were detected. The authors conclude that in patients who have major bleeding on factor Xa inhibitors, Andexanet markedly reduced anti-factor Xa activity, and 82% of patients had excellent or good hemostatic efficacy at 12 hours. Full study results are available at nejm.org.
Applications in medicine in patients with acute major bleeding associated with the use of factor XI inhibitor treatment with Andexanet markedly reduced anti-factor XI activity, and 80% of patients had excellent or good hemostatic efficacy at 12 hours, as educated according to pre-specified criteria.
So just a few words about emerging antidotes. So again, Andexanet alpha is the very specific antidote for the 10A inhibitors. It's a modified factor 10A, which works essentially as a decoy. It binds to and removes the 10A inhibitor from the circulation with very high affinity. In clinical trials that have been done so far, it's been administered to a substantial number of healthy volunteers, and some patients who are actively bleeding. It's had really no significant adverse effects. We haven't seen any evidence of thrombosis, although when it's administered to patients with no anti-10A inhibitor on board, there is some evidence of activation of coagulation, which may be beneficial in an actively bleeding patient. It produces short-term reversal after an intravenous bolus, and you can administer an infusion to produce long-term reversal. And there's trials going on now, a large clinical trial, which is enrolling patients treated with rivaroxaban and apixaban, and we anticipate shortly being able to add other 10A inhibitors to the eligible medications. Andexanet alpha produces reliable reversal of the anti-factor Xa effect of all of the 10A inhibitors, and this has been shown in numerous publications at conferences over the last 2 or 3 years. Essentially, to summarize all of the results, when you give an appropriate dose of Andexanet alpha, you produce a proportionate reduction in the levels of anti-factor Xa of any of the agents The effect is immediate at the end of the infusion and lasts for a period of about an hour or so. The drug has a short half-life, and then the drug returns to its anticipated level. You can prevent this recrudescence of the anti-10A effect by giving an infusion at the time of the bolus. And you can see from this slide that, for example, with rivaroxaban, there's a dose-dependent reduction in the 10A inhibition as you increase the dose of the Andexanet alfa. There's a large clinical development program, and the first of the studies that is probably going to lead to licensure of this product is called Annexa-R. It's divided into two parts. Part one is a bolus infusion of rivaroxaban. The primary endpoint is a surrogate, the percent change in anti-factor 10A activity from baseline to nadir in patients who are dosed to steady state and then receive a dose of the Andexanet alfa. The secondary endpoints are the occurrence of an 80% or greater reduction in anti-factor 10A levels, the change in free rivaroxaban concentrations, changes in thrombin generation, and the occurrence of thrombin generation above the lower limit of the derived.
Pros. The Andexanet alpha, a novel antidote for the anticoagulation effects of factor XA inhibitors study, is a single-group cohort study designated to assess the efficacy and safety of Andexanet in patients with acute major bleeding occurring while taking a factor XA inhibitor. Interesting results for the first 67 patients treated in this study were published previously.
More quickly with the administration of Andexanet alfa than was seen with the administration of placebo. So there's no doubt that with the new anticoagulant agents, we've really entered a new era in anticoagulant therapy. Much greater choice, probably easier to use than warfarin, probably safer than warfarin in many patients. Problem, of course, is that we don't have a reversal agent. It's been identified that there's a need for a reversal agent. We look forward to having reversal agents available to us, reversal agents that are able to ameliorate bleeding complications in really sick patients taking these anticoagulants. There's a lot of active research in this domain, publications almost every month, certainly every major scientific congress. An exciting area to be working in. We look forward to additional information.
Cons. Factor XI inhibitors have a favorable benefit-risk profile for the treatment and prevention of thrombotic events that might cause or worsen acute major bleeding with substantial morbidity or mortality. Issue applied in Ecuador. Among patients with acute major bleeding associated with anti-factor XA medication, primarily apixaban or rivaroxaban, anti-XA activity was significantly reduced and good or excellent hemostasis was achieved by 12 hours in the vast majority of patients.
Factor Xa inhibitors such as apixaban and rivaroxaban are convenient to take but can cause bleeding complications. Many physicians hesitate to use them because there's no easy way to reverse the effects of treatment in the event of an accident, internal bleeding, or a surgical emergency. Andexanet is a fragment of factor Xa that was designed to rapidly reverse the anticoagulant effects of these inhibitors by preventing their binding to authentic factor Xa. To test the efficacy of Andexanet, a small phase 3 trial was designed with healthy older volunteers as the participants. They were given either 10 milligrams of apixaban or 20 milligrams of rivaroxaban daily until steady-state anticoagulation had been achieved. Then intravenous Andexanet was given to determine whether the effects of these anticoagulants on blood clotting could be reversed, and if so, what the side effects might be. The primary outcome was the mean percent change in anti-factor Xa activity, which was significantly reduced both in participants who received a bolus of Andexanet and in those who received a bolus followed by an infusion of the drug. Participants who received a bolus of Andexanet had fully restored thrombin generation within 2 to 5 minutes, and this effect was sustained while Andexanet was given as an infusion after the bolus. No serious adverse events were noted. The authors conclude that Andexanet reversed the anticoagulant activity of apixaban and rivaroxaban in healthy older volunteers within minutes and for the duration of infusion, without evidence of clinical toxicity. Full trial results are available at any.
Conclusion. Factor XI inhibitors have a favorable benefit-risk profile for the treatment and prevention of thrombotic events, but might cause or worsen acute major bleeding with substantial morbidity or mortality. Andexanet alpha is a modified recombinant inactive for human factor XI designated specifically for bind and sequester factor XI inhibitor molecules. Therapy rapidly reducing anti-factor XI activity and measure of the anticoagulant effect for factor XI inhibitors.
Hello, this is Dr. Sam Goldhaber. I'm president of NATF, and today on Clot Chronicles, we're going to share some late-breaking news, and that is that the FDA approved a new medication called Andexanet. Andexanet is an antidote for major bleeding that can occur when patients are given direct oral anticoagulants, such as rivaroxaban or apixaban or edoxaban or betrixaban. You may be more familiar with the trade names of some of these medications, which include Xarelto and Eliquis and Savesa. Until now, we have not had a way to directly reverse this new class of oral anticoagulants. We're using these new oral anticoagulants more and more frequently because they have fewer bleeding complications than warfarin. They're also much easier to administer because they're given in a fixed dose. There's no need for any laboratory blood testing or dose adjustment. And not only are they safer, but certainly for stroke prevention and atrial fibrillation, some of these direct oral anticoagulants called DOACs, and sometimes they're described as novel oral anticoagulants or NOACs, sometimes they're even more effective for preventing stroke in patients who have atrial fibrillation. The new antidote, just FDA approved, is a universal type of agent that can reverse major bleeding from any of these DOACs that work against clotting factor 10. So Andexanet is the antidote for 4 of the DOACs: rivaroxaban, apixaban, edoxaban, and betrixaban. It's delivered intravenously, and it is an antidote that I am sure will be kept in all hospitals in case they have to treat patients with a major bleeding complication. It's an important addition to our armamentarium. For several years now, we have had an antidote for dabigatran, which is also called Pradaxa, and that antidote's worked very well, but it's only useful for patients who are taking dabigatran and not for the other direct oral anticoagulants. So now, when the other direct oral anticoagulants are prescribed, we can prescribe them with more confidence, knowing that in the rare situations where a major bleeding complication might occur, we can reach for Andexanet as the reversal agent. This is Dr. Sam Goldhaber signing off for Clot